Heart failure is a condition where the cardiac output or the forward flow is diminished. There are two kinds. One is called systolic, where the heart is weaker. Normally your heart's supposed to pump like this, and it just barely twitches, it gets weak. Another kind is called preserved ejection fraction or diastolic dysfunction, where the heart squeezes just fine, but the relaxation phase is impaired. Both of them cause a lack of forward flow. There are several ways to treat this. Number one, you have to fix the underlying condition. Now, there are too many of these to go through, but in systolic heart failure, at least, the number one cause is usually blocked arteries. There could be also hypertension and other things, viruses, what have you. In diastole, it's a lot of things. We're going to skip that one because it's just way too many. After that, you correct if there's a plugged up artery or blood pressure, whatever. If they're still in heart failure, which at this point they are, there are several medications you can use. Number one would be Entresto. You put people on Entresto. If they can't tolerate the Entresto or it's too expensive, which it is, you can use an ACE inhibitor or an ARB, an angiotensin receptor blocker. Next, you would use something like spironolactone, eplerenone, or finerenone. These are called mineralocorticoid or antagonists. You want to use one of those because it blocks some of the hormonal things that cause heart failure and make it worse. Next, you want to use one of the approved beta blockers. Usually it's carvedilol or metoprolol tartrate. They've been studied in this and they actually work. Those are the two most common in the United States. Last but not least, you want to use something called an SGLT2 inhibitor. And don't get me wrong, patients need to be on all of these. The SGLT2 inhibitors are something like Farxiga, Invokana, or Jardiance. Now, not all of them are approved for heart failure, but eventually when they're all generic, it's a class effect, they all will be. So that's kind of how you treat heart failure, and that's exactly what it is. Follow cardiologists for more.